Okay, looks like we are live, and I'm not supposed to say that anymore, right? Just once we're on, we're on. Okay, so those who are watching us on LinkedIn or Facebook, or actually even on YouTube, actually just put it there as well. So thank you for taking some time out of your schedules today and joining us for another live broadcast of the Nursing Home Podcast, the only podcast that you need to listen to learn about what's really going on in the healthcare industry, more specifically, the nursing home industry. Most people get their information from the media, you get information from your friends and from a couple of maybe experiences and interactions with the nursing home center or the space in general. We're here to bring on professionals, health providers, service providers, and all different aspects of this industry to really share what it's actually like and what does it really mean to operate in this space. What does it really mean to be a resident? What does it mean to be a caregiver? What does it mean to be a service provider? That and lots more. So today we're going to discuss specifically the communication challenge that exists between nursing home providers and their hospital referral partners. So, traditionally, this is why I love this podcast. So let's say things the way that they are. Traditionally, nursing home marketers, liaisons, call them whatever you want, they're drooling all over the hospital discharge planners. If it was legal like it used to be, they would put them in limousines and take them to parties every night and give them money and gifts and whatever they can to get in their favor. Not because they are looking for long term personal relationships or even professional relationships necessarily, but they want those referrals because referrals equals revenue, and they know that their jobs are dependent on getting residents into the facility. It's simple as that. And every facility, they're fighting over the good residents, meaning the residents have a good pay source. Fortunately for the industry, unfortunately for maybe for providers, makes it a challenge. Those things, most places, even pre-COVID, that's not possible anymore. Most places don't accept that; they don't allow it, and those easy days are over. So now it's important to have actual, real relationships with hospital partners. It's important, and it's a two-way street. The hospital providers also need the nursing homes. They're partners in this, right? At the end of the day, the hospital cannot do this alone. The hospitals also have their own pressure to discharge the residents in a timely way in order to ensure that they're getting paid for the service that they're providing when they're no longer getting paid, which is supposed to be when the resident or patient no longer needs their level of care, then they send them to down the street to the nursing homes. So the tradition, it's always been a challenge. Michael, we're going to get to in a minute, but tradition, it's always been a challenge. Many times the admission coordinators will use the opportunity of sending their daily census. They'll fax it in. For those of you who don't know what fax machines are, well, you may still be able to find fax paper in your local antique shop, but people used to actually take the opportunity to fax in their availability to the case managers as a little reminder that, hey, we exist, and hey, we're desperate for a census, so please send us anything and anyone as long as they have a pulse. Even if they don't have a payer, we'll somehow figure out how to charge that pulse for their stay. And being crass for a reason, because it's a real challenge. You don't want to be annoying, right? You don't want it to be problematic. Good afternoon, Joel. Joel is checking in, so he'll get himself an honorable mention. Um, so you don't want to be annoying. You don't want to, but at the same time, you do. What are you supposed to do? And part of it is also practical. So
Right.
we're going to get into this and much more. But before we get too far, I want to officially extend a very warm welcome to Michael Radut. Michael is I said I'm going to call you the marketing guy, the business development guy, but you're the growth marketing and customer success person for care availability. So, Michael, welcome to the Nursing Home Podcast.
Thank you. Thanks for having me, Shmel. Really appreciate this. It's really exciting to be able to talk to the broader, healthcare industry network with folks from all over the place. We're out here on the West Coast. We're kind of in our own world with how we do things, so it's pretty exciting to talk to people who are out in other markets.
Hmm.
Thanks for having me.
We're on Sure, we're on the opposite coast, right over here on the Boston, New York side of the country. Before we even get too much into the topic that we started discussing, and I do want to discuss even before care availability, which is your company, but even before that, I wanted to discuss the problem. But let's give our listeners and viewers a chance to learn a little bit about who you are. So, can you give us the short version of your professional trajectory of how you ended up in the current role that you're in right now?
Sure, sure. So, it's interesting. I grew up in this industry. My family, my family's from Romania, and when they came out here, my parents, the only jobs they could get were as caregivers, and that kind of ushered them into a world of like any other story of coming to this country, and eventually you kind of own the place that you first get your job at. So they showed up, got jobs as caregivers. Eventually, I saw them grow that job into their own business, where they actually own and operated residential care homes throughout the Portland area here. And
Wow.
so seeing them go through that process, naturally I saw a lot of the challenges, and moving forward a little bit of time, I had to step in because my dad got sick, and he kind of had to step away and retire. And so I stepped in and ran the business for a little while. And during that time, I came from a marketing world, and that was my that's really where my wheelhouse is. And I noticed that there was a gap between uh, what marketing really means and how technology supports other services and other businesses and other industries, and just not so much in healthcare, not so much specifically to the community-based care providers like the adult family homes, the home health companies, hospice, home care, smaller assisted livings, all of that. So to keep it short, eventually I really just embarked out on this mission to try to bring some innovation to that space, and try to create a better way for patients, for potential residents, to get connected to community-based services, and try to help bridge the gap between the health systems and the providers who are out in the communities that otherwise, they wouldn't really know about each other. And so that's what brought me to care availability. Prior to care availability, I was working on a different company, and then I joined the team that launched care availability in the last year, and really joined them right at the time, right before COVID really took off, and we were all forced
Hmm.
with dealing with this new way of life, essentially, especially for healthcare sales and marketing professionals. It was different. It's a different world. And
Hmm.
so it was really all hands on deck at that point. So I jumped in and focused everything on engagement, on bringing on more providers, on some of our key relationships with hospitals and all of that. So still haven't figured out what my title is, since I kind of do everything from content creation to digital marketing to hosting some case management meetings and all of that. So kind of all over the place. Um,
Okay.
yeah.
Well, first of all, thank you for that very full background.
Sure.
Your parents definitely set the bar very high, coming in, as immigrants to the country, and starting at the bottom of the ladder. And like you said, they owned and operated care facilities in the area, multiple facilities. So they really showed you how, starting with nothing, they were able to build what they built. So you
Yeah.
obviously have that in your DNA. Not necessarily, but you probably have some of that in your DNA.
Well, I see it.
Where
I saw the struggle.
you saw, and I'm sure there were things that you saw that you said, "I will never do that," and I'm never going to go through whatever particular pains or suffering that you may have seen them do. It's just the pattern, like every other generation, right? The kids don't want to be like the parents, but the grandkids sometimes they want to be like the grandparents. But I'm sure there's certain aspects that were amazing, certain aspects that were not. But one thing is clear is you had a very unique perspective or a bird's eye view, on the industry as a whole, where you're able to see what they actually did. You're able to see what other providers in the community are doing, and where some of the gaps are. So let's go specifically to care availability. I know you alluded to it a little bit before, but what is the problem that care availability is coming to solve, and how does it do that?
Sure. So, one of the pieces of technology that has been really growing in the referral care coordination space has been services that primarily just focus on Medicare licensed providers, and not so much on the community based providers like assisted livings, adult family homes, and all of that. And so care availability is trying to solve the issue of helping folks kind of self navigate the healthcare system without having to rely on third party referral services, and having to rely on just traditional fax blasts and things like that of vacancy information. There's a real problem when a case manager in a hospital needs to make a referral decision and help patients kind of navigate out of the hospital and into a setting that's appropriate for them, but they
Mm-hmm.
have to spend hours Googling, cold calling, trying to find the availability, trying to find what's available in the local area that meets the patient's budget, or accepts the patient's payer source, provides a Hoyer lift, provides two-person transfers. There's a lot of assisted livings that don't do that, and so it's good to have all that information in one place. So that's really what we're trying to solve, is just help be able to coordinate care on their own.
So, okay, so how do we do it? Let me ask a hard question here. So I've been a nursing home administrator for a number of years, and the big part of my day was figuring out how we going to build the census today. Every admission is celebrated. Every discharge is, I don't know, not discouraged, but it's like even if it's a healthy discharge, it just means the census goes down. So everything is census, census, census. Obviously, the goal is to provide the highest level of care while they're in the facility. But if you don't have people to care for, then you have no business. And most of the facilities are for-profit facilities, and even if they aren't, they still have to function. They have to function properly. So when a hospital had a patient to discharge, especially if it was a desirable patient, usually what they would do is they would go to some of the online systems that already existed. So let's back up. It used to be that they would send out emails or they'd send out faxes, and you print out a million pieces of paper, and the admission folks would have to sort through it and then figure out what's a financial question, what's a clinical question, what's an administrator question, so to get the regional people to sign off on certain things. Some of them will be complex, and they know certain things that they have the ability, the permission to just say yes automatically, because these things have already been predetermined. But that has evolved, as you know, right, to the online systems. And I don't know what it is on your side of the world, but we have Allscripts and Fornext and
Right.
and I don't know, all these different systems where instead of faxing over the referrals, they're not doing that anymore. Instead, they're putting all their information right in the system. You basically have access to everything that the facility might need, and the facilities go in there like a bunch of hawks, and they attack that
Yeah.
referral
Uh-huh.
from every angle, and they're going to do whatever they can to give a yes answer as quickly as possible.
Sure.
So is this really a real, like, is this the pain so I've gone to hospitals and met with case managers, met with the teams of case managers, and I don't know if I necessarily heard this as a pain point from them that, oh, we don't know who to refer this person to, because usually, put it this way, even sometimes they'll even play dirty, right? Let's just say it the way it is. Sometimes they'll say somebody is 340 pounds, and it comes out that the person is 640 pounds. And the equipment that we special ordered for this resident, standard bariatric equipment just doesn't work. The person walks in the door. And you can't say anything, because if you say the wrong thing, then you become a bad facility, and then you lose patients down the road. So there's certainly challenges with that. My point with all this is that generally nursing homes are desperate for census, even a good facility, and even the good facilities are super aggressive with getting a yes and getting yes as quickly as possible. So was this really a struggle, and is it really a struggle for case managers to say, oh my gosh, I have this resident, I have this patient in the hospital, we still call them patients, right? So I have this patient and I don't know where to send them. Is that a real problem?
Absolutely. Absolutely. I think if you have your relationships with your nursing homes that you rely on, you kind of have that rep that you work with, you have the liaison that keeps the coffee rolling into the office and all of that, and you know them, and so you reach out to them. They have access to your NaviHealth, they have access to Epic, whatever it may be. They can pull the
Epic, yeah,
information, they can make it happen for you. Um,
right.
I think the real issue is when we're looking at post-acute providers that aren't necessarily nursing homes that don't, there are a lot of patients that go to nursing homes that ICF level bed or whatever in the nursing home might not necessarily be the most appropriate level of care for that patient. So
Okay.
what we're doing is we're solving if there's a patient in a hospital that is approved for Medicaid and the hospital has gone through that whole process and got them ready to go, and the only thing that they can find that provides ventilator care or that provides something a little bit higher level than your traditional assisted living, the only place for that patient to go is an ICF. And that might not be the best place for that patient and that family. A better situation might be the residential care home that's owned and operated by a small family, small business, 5 miles away, not that far. They just don't know about it because they don't have that relationship. So that facility is licensed, ready to take on that care. They provide that care. But because they don't have that same relationship like the nursing homes do with the hospital systems, they often miss out on that. And so I can see we might be thinking about like the traditional patient that's ordered to go to a SNF, meets their physical therapy, all of that, and we help facilitate those referrals as well. And really that was accelerated throughout COVID, the need there, because with reduced visitation in the hospital, there's no reps bringing coffee in. There's no reps letting them know about their vacancies. And so
So
rather than
hold on. Yeah, I have too many questions here. I don't like to interrupt, but I am. First of all, what's ICF?
So that's going to be a bed that's designated for a patient that can stay long term in the SNF.
Oh, the long term. Okay, a long term.
Yeah, I don't
So
know if there's a different language on over there or anything like
okay,
that.
fine, fine. Okay. So let me just wrap my head around this. So a couple of things. So first thing you're saying is that there are other care providers that besides for nursing homes, assisted livings, like you said, if there's a specific need, let's say a ventilator patient or something else that their needs can be met equally or maybe even better in another setting, so there isn't a simple way for the hospital discharge planners to know that such a place exists and to know the information, whatever questions they might have. um, it's almost okay coming from my world as a marketer, and we market lots of businesses, so it's almost like your Google My Business page
Sure.
for healthcare providers. So if you want to know, if you're someone like me and you eat kosher food and you're hungry, and so you put into Google kosher near me and you get a list of places, and
Yeah.
then you'll get basic information about each place. You'll see the pictures, see the reviews. Then you'll decide which one you want to actually take your next action with, and call them or drive there, or click for directions or whatever. So from the discharge planner's perspective, a lot of P's in there. From their end, they can send it out and wait for the wolves to attack and chew up their referral, and then come back and say that this is for them. But if they want to see all the possible options, so by clicking the check boxes of the specific needs of this patient, and to see where their needs can be met across the continuum of healthcare in that specific area, that's not something that they can currently do. Right now, they're somewhat at the mercy, of the nursing homes, and they don't even have the ability to kind of look out of the box and see where else they can go, because they're not, they just put it into the system and they wait for stuff to happen. So this gives the hospital discharge planners the ability to proactively find the best possible care setting for their patients post discharge, from the acute care setting. So that's a big deal. So it's not just. So I guess my point was that I've never seen it a problem that the case managers, the easy referrals get eaten up right away, right? And the nursing homes are going to grab them. There are more complex ones. So then a lot of nursing homes are going to jump on those too, so that you can be that provider that is always there to help out. But
Right.
you're saying more than that, and those are the ones that can sometimes sit, and sometimes it can be a payer issue, sometimes it can be a family issue. They're restraining orders and all sorts of crazy stuff.
Yeah.
When people come into a healthcare setting, sometimes there's this notion that all of a sudden the healthcare provider takes over the entire life challenge that this patient or family has had, and all of a sudden the 45 years of bickering is going to be resolved during this care plan meeting when they all come in at the same time and start yelling at each other. And okay, fine, I digress. My point is like this. My point is that this gives the discharge planners the ability to really see the every possible situation. It's like a Google search, I guess. I'm going big with the parables today,
Yeah.
right? With the comparisons today, but basically saying that this is, or more like Amazon, where you can tick
Right.
the boxes on the side.
I guess I like to make the comparison more to like an Expedia, for example, because if you and I had to cold call every hotel, if I wanted to visit you in Boston and I had to call every hotel in Boston on my way out
Oh,
there,
you would stay in my house, Michael. Come on.
uh, I thank you. I gladly accepted. But say I couldn't, right? I
Yeah.
had to cold call every hotel to find out their pricing, find out if they have the amenities that I'm looking for, find out if they even have availability. I mean, that's extremely daunting for me to think about even doing that. I've never had to do
Mm-hmm.
that. And
Mm-hmm.
so I think about putting myself in the shoes of a patient in a hospital and a family who's trying to make the decision of finding some place, and the only real option they have is the sniffs that this patient can go to. But let's say they're right at that line where they don't necessarily have to go to a sniff. A better level of care might be a care home that has specific services that will meet that patient's needs and much more one-on-one as well. That might be better for
Mm-hmm.
them. And really,
Mm-hmm.
care availability is for the case management teams, but it's also for the patients and the families to be able to self-navigate through that decision, um, rather than calling 10 home health companies to see if they accept your insurance and to see if they have a start of care date available for you this week. You could just go on care availability and search for the available providers in your area that are ready to take you on. And it's kind of the same thing for all the other providers. So it's not, we're working with SNFs, and we really started working with SNFs because that was an ask from the hospital systems that we were working with, throughout COVID. They
1 second. So let's dwell on that for a second. What do you mean it was an ask from them? What were they asking specifically?
Sure. So to give you a little bit of context, care availability when it first started, it was a lot of conversations with the hospital and a lot of discovery and trying to figure out what they really need from a tool like this. And
Okay.
fast forward like a month or two, the pandemic hit, and all of a sudden they're like, "Hey, that tool that you were telling us, we really need that now. Like, really? How can we?"
Because.
Because one, they had no idea which nursing facilities have current COVID outbreaks until they call them and figure that out. So we put that on our site as well so that folks can actually report that they're not accepting due to COVID right now. The other piece to
Mm-hmm.
it, case management teams during an overburdened time where their staff is focused on just trying to get patients out the door in the proper settings and try to make room in the hospital. The problem was sifting through tons of communication coming in from the reps, coming in from the nursing facilities, fax blasts, emails, phone calls, all of that. And they're like, I can't have time to do this because pre-COVID it was easy. I had 5 people walk in and tell me what they had going on today, and they could do an assessment right here, right now. But if my hospital is closed down and we can't do assessments and I can't allow outside providers to come in, there's kind of a barrier there in communication. And so, our platform offered the ability for them to report their vacancies, and the case management teams can just do a quick search, see everything that's available, and then make a decision from there based on what the patient's needs are. So that's how really we started working with SNFs, and then we kind of expanded that to broader services, assisted livings, home cares, hospice, home health, all of that.
Well, wow. So that's just light bulbs going on now. I'm just kind of
Yeah,
starting to grapple with the concept here
yeah,
because I mean, the name is exactly what it is, right? Care availability. So it's almost a different approach that we're not looking at nursing homes, we're not looking at hospitals, we're not looking at home care companies. We're looking at the care that needs to be provided for this particular patient with this, in this location at this time, and we want to know where is that care available? Where can this person go? Where can this human being be cared for in the best possible way? That's what we're trying to figure out.
Yeah.
That currently is not available. So
No.
so usually it starts typically, right? It starts in the hospital. It was an acute event, and now let's at least stick with that example. There's an acute event. Someone ends up in the hospital, and now we have to figure out what the next step is. So, first of all, what you're saying is that we want to explore all options. We don't want people to have to be geographically challenged. They don't have to drive an hour each way to visit mom, if it could be avoided. And many times, unfortunately, these types of things, which make a huge deal in the family members' experience, and many times the residents as well, are completely overlooked or ignored because we're just trying to get the best possible care. But we didn't know that there's a new nursing home around the corner from where the daughter lives that can provide that care even better than the other place, which you're just going to send to because you know that Betsy always picks up the phone and she'll just make it happen. Right? And this happens all the time. I think we both know that. So right, and if there's no easy way to find out, even without COVID, right? So how does a case manager typically know the care availability? I want to stick to nursing homes for a minute because even within the nursing home space, I think there's a huge need for this because how does a hospital discharge planner know the availability in the local, just even in the nursing homes? So like you said, someone walks in with coffee and says, "How can I help you?" Which means, please, 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 please give me a referral, and I'll make it happen no matter what, as long as the person is still alive. And then there's all those faxes that come in, which, like you said, on a regular day, you have 5 people manning all that information. It's manageable, but other than that, it can be a real challenge, understanding and seeing and knowing what the options are, even just within the nursing home space. So having all that information available at the click of a button, and you can be as specific as as the system allows you to be, that is a tremendous tool for the discharge planners. And like you said before, an even bigger thing is that who says they have to go to a nursing home? If the system spits out 4 other options, that might be even something that that's even better. So I got that. Now I get it. I didn't before. I know I do. But let's move on from there to another point. That's from the discharge planner standpoint. What about from the family standpoint? You said that they can self-navigate. What does that even mean?
Yeah, so I think traditionally the families and patients who are involved in coordinating care for for themselves, for their loved one, when they get to that point where they're now having to navigate through the hundreds of home care options and the tons of different levels of care that's available to them in the area, they have no idea where to begin. And so most of the time you're going to rely on sources that the senior centers are going to offer. You're going to rely on sources that the case management teams are going to offer to you. But a lot of the times, that's a business card and that's a flyer of a service that's going to take that and then continue to help you self-navigate. There's really nothing where you can just take it right now and find exactly what you're looking for and self-navigate the challenges and the complexities of all the different services around you. This company was built on providing that value to patients to self-navigate. One thing that we had talked about a couple of weeks back on a phone call is that the company that this grew out of is Retirement Connection. So we have these Retirement Connection guides, right? And these things get dropped off, and they are the leading resource for all the hospitals and all the senior centers, and they can kind of look through here and find whatever service they're looking for. Assisted living, home care, all of that. But there's no way to really navigate through all of this because you still have to call everybody. And so,
hold on, another light bulb moment. Hold on, because those things, I used to hate those things because myself knew, don't give me paper, give me a paper. It's gonna end up it's gonna end up in the garbage, and it's never gonna actually be used. It's never actually gonna be used at all. And the social workers, the district planners in the hospitals, that's their Bible, right? And they use that when they want to find home care companies. They want to find, visiting nurses service. They want to find, the VNAs. They want to figure out where they're going to discharge this resident post their inpatient stay at the nursing home. That's what they use. So first of all, this is a awesome tool for them. They want to know who they can use, which insurances. So again, how do they make that? What's the reason why hospice companies and home care companies come every single week to every sniff in the country, I assume, and they give out free lunches, and they bring, whatever they bring. I don't know. I would say bagels and lox, but I never keep the food because it's not kosher. But whatever it is, they bring Paneras and all this other stuff.
Yeah.
And the staff, we always welcome them in because free lunch and a diversion from stuff we're really supposed to do is great. But for them, they're begging for business. So now they're doing to us what we do to the hospital case managers, discharge planners. And many times it's effective because if this is the person that comes here consistently, they bring us lunch once a month, and we know who they are, and we've sent a couple of patients home with them, and it worked out well, we'll continue doing that. Why not? But now we have the opportunity to, hopefully we still get the lunches, but we have the opportunity of actually just putting in the information that we need. This is the care that we're looking for, and now it's available. And now you don't need to be, this is a question and a statement, you don't need to be a hospital discharge planner or a social worker in a nursing home to have access to this information. Is that true? The information is available to everybody?
Yeah, 100%. Care availability is designed to allow everybody to use this anytime, anywhere, on any device. Family, case management team, social worker on a home health company.
Awesome.
Helping a patient in their home. I mean, they can pull this up, and if they see, hey, that's one of my favorite use cases, actually. The social worker who's on a home health team, who's inside of a patient's home, currently dealing with an issue, right? And they say, hey, based on the physical therapist's advice and based on my advice, I think it's time for you to go somewhere. Again, that social worker just has flyers, cards, so they can pull.
Yeah, what's the knee-jerk reaction? What do? Oh, this person is a hospital. And if you have a smart, forward-thinking nursing home, they say, oh, we have a direct admit program because you discharged less than 30 days ago. You could do that. But they don't know that there's a place down the block where you can go outpatient and visit. You could go right now, actually. They're open, and they can do this also, and they're also covered, and it's much better and much more convenient. Every time the patient goes to the hospital, they're exposed, even not in COVID times, they're exposed to who knows what. And it just makes it's a huge challenge for them, and it's very stressful for them, and it's very disruptive, and it's many times not necessary. And another thing here also is that now the family members, it's many times not the patient or the resident themselves, but the family members, the adult children have the ability, they're empowered to make decisions. And when the social worker says, okay, you're going home on this day with this service, they're like, 1 second, do we really need that service? Or I want to use that service, or however it is. But now that, and even when they're in the hospital and they know that they're going to be discharged, so many times, right, how are decisions made from the hospital discharge planners to a nursing home, to the next center, to the next place where they're going to be receiving their care? Many times it's through either the liaison that came in, it's whoever responded first, it's the one that we know. But now you have the family member there that says, hold on, I just went on my phone, my care availability app. You guys have an app?
No,
not yet.
Online. Yeah, not yet.
All right, fine. One day you guys will have an app, but if not, I'm on my phone right here. I'm on their website. For those who don't know, if you don't have an app, you can also go to the browser and get a website. I'm just messing with you. And I went right here and I see exactly, you said this is what we need. We need this type of thing. Right. And this home care company can provide the same care at home. Why should mom be stuck in a nursing home, which she said that kill me before you put me in a nursing home? She can actually get the same level of care at home. So why don't we do that?
Yeah.
And this is something which was never available until. This is the transparency that the internet has brought to so many other industries, to shopping industries, through Amazon reviews, to there's even staffing agencies. I was just talking with, we had an earlier episode with Chris Caulfield from IntelliCare, right, where you have, it's a nurse staffing agency where the facilities can review the nurses can review the facilities, and it just brings a certain level of transparency, which the ultimate goal is for the regular guy, right? The regular guy. So now when I want to buy something, I know what other people's opinions are. So if I'm being discharged, I'm not car dealerships, everything, every single industry, the internet has flipped it over. So now what you guys are doing, I think, is really revolutionary in that it brings power back to the people. It gives the ability for patients to be involved in their care. It gives the ability for the decision makers, the children, to be involved in their care. They're not just, oh my gosh, the hospital discharge planner is said I have to go here, so that's it. I think it's crazy. I think it's stupid, and I disagree. And I know that facility. My brother works there, and I've seen how they just throw people around, which is usually not true, but it's a different conversation. But now you're part of the process. Okay,
Yeah.
I'm sorry. I don't mean to get worked up here, but I think that's amazing.
Yeah, all of this is just making me. It's kind of burning this passion inside of me a lot more, because when I was in the residential care home world with my family, a lot of the challenges that I saw weren't necessarily challenges that we faced as providers. I
Hmm.
saw the struggle that the patients had and the families had in finding us, and then us not necessarily being the best setting for them at times, and then realizing that, hey, you only made the decision to come here because there was some service you interacted with that only worked with a handful of providers, and that's why you were referred here. It wasn't necessarily a decision based on what is best for you, because maybe there was a home with a wound care nurse that would have taken care of you a lot better. And so seeing that challenge was difficult, because patients, yeah, at that time when they're looking for a new setting and they're looking for a new placement, that's really hard on families. It's really hard on
Right. I
patients.
mean, and at the same time, they're at the mercy of the professionals who are telling them that this is your next stop, whether you like it or not. And
Yeah,
here are your three options, and you're going to choose this one. When really, like you said, who said that was the best setting for them?
yeah,
But just, I didn't realize at the time I was enjoying this and went later than I expected. But let's focus on one more point here, if you will, before, as we wrap up here. So this is a new age version of the clinical liaison, external marketer, nursing home patient grabber, snatcher, stealer, whatever you want to call that position of the person who is responsible to go fishing and bring the residents into the nursing home. So it's changed slowly, right, over the last few years, where more and more hospitals are quote unquote closed, right? They don't allow anyone in, period. Before COVID, nothing to do with infection control. They're moving more and more electronic, and now with COVID, many of them are completely closed, or probably all of them are. But more than that, it's also expressing a trend in communicating 100% online and embracing that technology. Now, what care availability is doing is you're giving one place for the hospital case managers to look at, the discharge place managers to go when they're looking to send someone to the next care setting. But at the same time, it gives all those care providers the responsibility and the opportunity to put their best foot forward, and they can make that profile, whatever it is, as fully optimized as possible. With
absolutely.
at the very least, it's with the basic information, with checking one box about whether you accept this insurance, or whether you can do bariatric patients, or whatever type of therapy you might do. Smoking facilities, some of them still exist, or
Yeah, and let me just
that itself. Go
real
ahead.
real quick with that. you know this is a tool that touches everybody. I mean, it touches the providers, the referral sources, the patients, everybody involved, right? And so when I'm working with providers and I'm bringing them on board, it's kind of a different conversation than we're talking with a family to show them care availability. And one really unique thing I've seen people do is use this not necessarily as just a random online kind of sales tool to help them build their census, but as an opportunity to strengthen the relationships with the referral sources as well. Because care
Hmm.
availability is 100% free for providers to come on board. The core product, the core service to report your availability, claim your listing, that's free. So if you start reporting your availability on careavailability.com and you walk into a hospital, you call a hospital and say, hey, I'm not going to come in there every single day to tell you what my availability is anymore. I'm just, you can go to careavailability.com, put in the zip code, find me, you'll see my information on there. because our intake person, our staff is updating this on a daily basis. And I've seen a lot of providers use it throughout COVID to really deepen those relationships, because now they're the ones that are set apart. Now they're the ones that just made it easier for the case manager. They just saved the case manager time. They no longer have to call you to find out what the availability is in your nursing home. They can just do a quick check.
So now, if I'm a provider, I'm going to say, and I already know the answer here, but I want to speak this out.
Yeah.
I'm going to say, wait, if I do that, so I get that one phone call and I get that goodwill one time, but what happens if I end up at result number 16 every time they look? So they were happy with me one time, but now going forward, they're not happy with me anymore, or they don't even know that I exist. So tell us about the premium features, which allows the providers to kind of be in your face a little bit and attract attention of the case managers in this new virtual world of careavailability.com.
Sure. So care availability is designed to reward providers who update their availability on a daily basis. We will never favor providers that pay for a premium profile, because I think ultimately, the product is built to serve patients, families, and case management teams and help providers. And so the success that a provider is going to have with care availability is 100% dependent on them, because it is designed for you to increase in the search rankings if you update your availability. So if I do a quick search today, right now, I'll see all of the top providers that updated their availability since this morning. If they updated on Sunday night before the week began, then they're not going to be on the list anymore. So really, it's you can rise to the top of the list. Just got to update your availability. It's that simple.
So where do the premium listings come in then?
What's that?
So what does a premium listing give a provider?
Sure. So a premium listing allows a provider to have an actual profile that folks can click into and interact with a little bit more about their service. They can add a description, they can add virtual tour links, videos, photos, brochures, pricing plans, things like that. Whereas the non-subscribed provider on care availability, they just have a listing on the search results, and there's a contact info button that you'll click, and it'll drop down their direct contact info.
Got it. Now, I'm assuming, based on what we discussed so far, they're only going to show up when they fit whatever the search criteria that whoever it is, the placement person is looking for, right? Even if they have a regular listing.
Yeah. So if you're searching for a private pay residential care facility that does two-person HORLIS, two-person transfers, you're only going to see those facilities.
Got it. Yeah. Got it. That definitely makes a lot of sense. And virtual tours definitely is a phenomenal product. We'll talk about that at a different time, right?
Yeah.
Really, so I like the example of Google My Business, because Google does this as well for local businesses, and this is actually, I think, an excellent example, because you're doing care availability, they're doing product and service availability. So if I want, and they always put the one who's looking, right, the searcher, however you refer to them, first, that we want them to get the results that they're looking for. So they're going to have free Google listings, which are quite intense, and there's quite a bit you can do with a free listing. And now they're rolling out, or at least they're supposed to be rolling out, paid listings. Now, Google might go from Google search, they don't favor those who update their websites more frequently necessarily. If you pay, you're going to be on top, whether you like it or not, before the organic stuff. So that might be a difference. But the concept is that there's a certain amount that they want you to have available for everybody, and a certain amount maybe not. Michael, it's been amazing having you on the podcast. I think this concept is revolutionary. We've spoken more than once before, I think. I never really fully got exactly how care availability to me before this conversation was another system that nursing homes have to deal with. And I can't tell you how many usernames and passwords we have as providers. I'm just talking from a nursing home standpoint. And I thought this was another one, but this is not just another. This is really a game changer. And it's not just for nursing homes. This is really the same system. It's almost like if every provider would be on the same page, if we had one system that connects all providers together, so that we can ensure that the patient has the best level of care, however they define that, That's kind of what this is. So this is really amazing.
We
If they want to learn more about care availability, where's the best place to send them, Michael?
careavailability.com. You can go check it out over there. Reach out to me on LinkedIn if you have any questions and just want to learn more about it. But other than that, I mean, careavailability.com will have everything. And in fact, if you are if you're looking for care for somebody in Oregon and Washington where we're currently serving, I mean, you could use it right now. If there's a discharge planner out in Boston that's looking for a patient that's moving to Portland, they could do it right now and search for what's available. So, I mean, it's pretty straightforward. We don't need to over-engineer a process that's already pretty complicated, Yeah.
All right. So now the question is going to be, I was going to ask you if you have any final thoughts. So I'm going to leave you with the final thought. What does this take to have this all over the country?
Sure. I think it's aligning the mission of creating a healthier industry. I think it's for us to get this across the country it's not about just doing a big sales push and getting billboards everywhere and whatever. It's just kind of crowdsourcing the heart behind the case manager and the mission behind most providers and why they're in the service that we're here. We're here to help patients and families. If everybody can understand that this is a platform that can be easily implemented into a workflow, can be easily implemented into a home care, that's all that it needs. And from my perspective, I think that mission and everybody aligning together to solve this challenge and bring value to patients and providers, I think that's what takes it for it to really go everywhere.
Got it. Okay. So I guess this is a first step in the journey. It's not the first, but a step. That people who are listening here. Is there something practically that someone can do if they want to bring this to their area, which is not an area that's currently covered? The people who are watching or listening in another state, what could they do?
Yes. So the best way is to go online, go to the provider registration site, part of the website, sign up as a new user. I'll see that come through. I'll link it up with the listing that chances are already in there, since we actually upload a lot of the information directly from Medicare API plugins and kind of state and licensing records. So a lot of the providers are already on. You just have to go on, sign up as a new user. We'll link you up to the right provider listing. If you don't have one, we'll quickly make one. And then tomorrow, you can literally call up your top 3 referral sources and say, hey, all of my availability now lives on careavailability.com. I just put it in there. That's it. That's a real practical way for folks to start doing that. And even sharing it, with other providers and just letting them know this is a free thing that can help you build your census.
So in short, there's no technical thing that needs to happen. It's just people have to adopt the system. The system can exist as is.
Yep.
Now you said that you pull in from some of the the directories and the government directories of listed and licensed providers.
Yeah.
So does that already exist in other states, or that has to be done manually? How does that work? If I want to find in Boston, Massachusetts, all the nursing homes that accept private pay, I don't know, private rooms, let's say. So is that already in the system, or once it's adopted, then you'll pull that information in?
So we pull it in from some states as we were kind of ramping up to bring in all the providers from as many states as possible. In Boston, I don't think we have anybody on there from Boston, but the information is controlled by whoever is going to lead that process on the provider side. Whoever's going to lead up the process of updating their availability. So if a nursing home in Boston today wanted to do it, I mean, they could go on, create their user account, create the provider profile, and then start reporting the availability.
Got it.
Be done in 5 minutes.
Amazing. All right, Michael, this is way over time, but I appreciate your generosity of your time, your experience, and your knowledge, and sharing this fantastic product and concept. I think it's really what got to me today was just the concept is that we don't have a nursing home that's looking for census. We don't have a hospital that's looking to maximize reimbursement. We don't have case managers and discharge planners and liaisons and CEOs that are looking to hold on to their jobs. We have patients, patient-centered care in the literal sense, that need care. And let's figure out where they need to go and where's the absolutely best place for them to get care based on their terms and their definitions, and put them first. And we'll all pitch in when we're right there. And guess what? If you're a provider and you're providing care where people don't really want it or need it, then maybe we should revisit if you should be providing that type of care in that location, the way that you're providing it. This also gives opportunity to see, like, okay, well, let's go on forever. Yeah, I'm sure that you can put analytics into this to track and trend and see, people are not interested in this. People are interested in this. So if you're a nursing home, you're not getting referrals. Well, here's why. Bring in this program and you're going to get referrals, because right now you're not showing up in the search results. It kind of, it makes it very measurable and very clear as to if you, it levels the playing field. It's just like every other industry. If you're not providing a product or a service that people actually want and need in the time or place where they want and need it, then you're not going to win. All right, Michael, thank you so much for joining us. Any final thoughts? I'll give you opportunity for some final thoughts. I know I spoke too much.
Sure. No, I just really want to, hit that point one more time. That really is about bringing it back to patient care, and it's about allowing patients and families to self navigate through this and kind of bringing some clarity to something that's pretty difficult to deal with and pretty confusing. It's really just focusing on them and making it better for them.
Awesome. Thank you so much, Michael, for coming on the podcast.
Absolutely.
Really appreciate it.